Every woman and girl deserves the right to make informed decisions about her health and future. But for many across Nigeria, accessing reproductive health care is far from easy. From rural communities with few health facilities to displacement camps where essential services are limited, many women struggle to obtain antenatal care, family planning, skilled birth attendance, and treatment for reproductive health conditions. Experts say financial constraints, harmful cultural practices, stigma, gender inequality, and long distances to health facilities continue to prevent women and girls from seeking timely care.
At Stand With a Girl initiative, we work with internally displaced persons camp, and oftentimes, even when they have clinics, mobile clinics, those clinics can barely take them like 1 year thereabout. It either collapses, and within the host community, there's always issues around who have access to the hospital, who doesn't, and every time we go, we continue to hear issues around someone losing their lives or not having access. We've seen organizations try their own bit by taking services to them, but that is not enough. So already it tells you that within the policy, we need to be very intentional in making sure that we have them in mind and also make them part of the conversation when such policy is being implemented.
Adolescents, persons with disabilities, migrants, and internally displaced women often face even greater barriers. The consequences are severe. Delayed access to reproductive health care increases the risk of maternal death, unintended pregnancies, unsafe abortions, and sexually transmitted infections, while limiting opportunities for education and economic empowerment. Health advocates are therefore calling for stronger government policies, increased investment in primary health care, improved availability of reproductive health commodities, comprehensive sexuality education, and the removal of barriers that discourage women and girls from seeking care.
Today's summit provide a valuable platform to reflect on progress, share lessons learned, identify challenges, and explore opportunities for strengthening policies and systems that support the health and well-being of people on the move. It is also an opportunity to reaffirm our collective responsibility to create an enabling environment where every individual can access the services they need without fear of stigma, discrimination, or exclusion.
At the Safe Passage Project Summit in Abuja, organized by the Planned Parenthood Federation of Nigeria, stakeholders emphasized that protecting sexual and reproductive health rights is essential to achieving gender equality and sustainable development. They urge governments, development partners, and civil society organizations to work together to ensure inclusive, affordable, and quality reproductive health care for all women and girls, including migrants, refugees, and other vulnerable groups.
Once there is a crisis and the people move, you would understand that naturally there is not any budgetary provisions from the government in respect of that. And of course, you know that at every given point in time, the government is also limited. And that is why this project comes in so has to, fill in that gap that is created from the deficiencies of the government.
One of the activities that we do as an organization is give them support at these critical points where they pass through, provide them with clinical services across the major points that we encounter, and including protection services, guidance, and legal representation where they need be.
Breaking barriers to reproductive health care is not just about improving access to services. It is about safeguarding the health, dignity, and future of every woman and girl. As stakeholders push for inclusive policies and stronger health systems, the hope is that no woman or girl will be left behind. In Abuja, Joseph Bitrus, Rapid TV News.